Hi, class. Welcome to week two. I hope you're all doing well and hopefully are developing some level of rhythm for working through these courses. We're going to be talking about structural and strategic therapy, I should say theories of therapy. Um, Structural and strategic are two family modalities that you'll probably use. These are ones too, like if I recall from my state licensing exam, we talked about a lot in the test. They can be a little confusing when they sound similar, right? Structural, strategic, but their methodologies differ and they are different, obviously. And so, with any theory, you are going to figure out which theories work best for you and your personality and your style. Some of you may get to practicum sites that have a level of requirement that you have to work through a certain therapeutic lens. Others of you are going to be at sites that are more open to your personal style. Ultimately, whenever you are licensed and you kind of have a little bit more freedom to do what you so choose within legal and ethical rights, you're going to find a style that works best for you. Now, there might be parts or things of each one that you kind of like or whatever. The nice thing is, as you progress in your career, you can decide to do specializations or things of that nature that help you to develop further in specific styles of theory. Um, but I do think that there are theories that suit each individual, the clinician, the best. What may work for you may be different than what works best for a colleague, and that's okay. Um, Ultimately, you want to feel comfortable in doing the work that you're doing. And so you might see some of these things and you might be like, oh, that sounds great. And this is something I want to note for the future. Great. If I don't think any of you are at sites yet, but if any of you were at a site, this might open the door for you trying some things with clients, obviously in a legal and professional way. The beautiful thing is that while you're in practicum and as you're a post grad, as an associate, you will be under the supervision of a licensed clinician. So you have opportunities to try things, to read books and better develop yourself and really see what works with clients and what works with your style, which is really great. It really puts this learning into practice and makes it really practical. And that's what's great about a graduate program is you're getting to put some of these things into practice. But this is what you'll see when theory comes to life, when you actually start to get to utilize it with people in front of you. And so the therapist's role in strategic positioning is what response from the therapist is most likely to promote change. We're looking for change. And when you think of strategic, I think of the word strategy, right? Like we're trying to figure out a way to get an outcome that we want, what the family wants. Okay, so if a family may benefit from joining together and not liking it, it is okay. So, for example, if the family will join together by not liking the therapist, and the therapist is going to reinforce that. Sounds strange, but it's like the idea is we're trying to get them to work together. So if the therapist notices like, oh, they work together when they're against me, then let's support that. It sounds strange. We'll explain this a little bit more as we go on, but that's just an example. So anyways, it's a little unique. We have something we'll get to. It's called prescribing the symptom, but it's one of the methods with strategic family therapy. So there's 6 ways to think about a problem: involuntary versus voluntary, helplessness versus power, metaphorical versus literal, hierarchy versus equality, and hostility versus love. Okay. Symptoms indicate a stage of life problem which therapists can use to identify where and how to intervene. So obviously we have the life stages, right? Like birth to early childhood, to school, adolescence, leaving home, becoming a parent, becoming a grandparent, old age. Person may have difficulties transitioning to new phase of life. Family must renegotiate balance and independence and interdependence. Family hierarchy: who has the influence in what arenas. And this could look very different, right? Like when you look at a family, when I see a family, there's different dynamics. One, is it blended? Is there a cultural implication with the family, a religious implication with the family? Oftentimes we have parents bringing in adolescents. There's an identified patient. Um, and so everything's blamed on them. Who holds the power in the family? This can be observed just from how people sit in a room. um, it's very interesting depending on like who sits by who. You can kind of start gauging, but you're wanting to see who has the influence and who has the power, right? And it may not be the adults, you know. We're observing interactions. Maybe not from one interaction, but we're observing interactions, patterns of hierarchy, parent-child hierarchy, child acts on parent requests, or parents cave into child. What's the dynamic that's going on between these people? That's what we're looking for. And this is interesting when you're seeing this interact in a room, like when you see how people sit with each other, how they talk to each other, who's aligned and who's not aligned, things of that nature. You can see it with people, like with how they just sit on your couch, like I said. And that's where, making sure if you're choosing to work with a lot of families or your site works with a lot of families, hopefully you have a space to accommodate their needs, because it's important for everyone to feel comfortable in a room. But like when there is a little bit more space, that's where you can kind of see some dynamics. Some strategic goals. No predefined set of long-term goals other than to promote change that alters people's experience, moods, thoughts, and behaviors. And the goal too is with that change is that it's like a real change, right? Help clients find ways to love without dominating, intruding upon, or harming others. Okay. Which is like we want to change patterns. Correcting the couple or family hierarchy, reducing intrusion, right? Reuniting family members, changing who is helpful and how, repenting for an injustice and forgiving, and increasing the expression of compassion and unity, trying to figure out how we can work together once again. So types of directives. The therapist tends to be more straightforward, especially when you have the power of influence. Indirectives used when therapist has less authority with client. So we're going to get to this, but that's where you might use more paradox or metaphors. It depends on your role and your relationship with the family, how bought in they are, how they seem to receive your information. Do they listen to you? Do they like you? Are they for therapy, not for therapy? These are all the things to take into consideration. So straightforward directives: assess the situation, target a small sequence of change, start small maybe, motivate the family, give precise, doable instruction. Okay, review the task, request a task report. We talk about habit stacking these days. Start with one thing and then we'll move to other things. Oftentimes a family can see a lot of things that need to change, but maybe we just need to start with one thing changing and really target that one thing, and one thing that they are actually willing to change, right? I could probably list 1,000 things I need to change about myself, but what's one thing I'm willing to change? Okay. Now, paradoxical interventions are a little unique. So symptom prescription, I mentioned that a little earlier. So instructing clients to gauge in the problem behavior in some fashion. So for example, if mom and dad fight all the time and the goal is not to fight, you might prescribe, I'm prescribing for you to fight all the time. That sounds strange, but oftentimes when we do something like that, it causes people to do it less. This is maybe used well with families that avoid change or are with, symptoms that are kind of not in control. Clients with symptoms, they claim they cannot control the symptom. Symptom prescription changes the context of the problem behavior. They'll be like, what? You want me to fight with her all the time? Right? It's kind of interesting and strange. It seems to work though. Anyways. Metaphorical tasks used when it's not appropriate to explicitly address a problem. Pretend techniques, fake it till you make it. Ordeal therapy. Ordeals used when client feels helpless in controlling symptoms. Okay, a little interesting, may feel a little different. but it does seem to work. And it might be a strategy you really like as you face families and work with families. Family therapy is very dynamic in the sense of you have a lot of people in the room. There can be a lot of tension. Usually people are there for a reason, and so this can be there can be a lot going on. And so you'll observe your family and kind of then get an idea of like what's the best strategy to take. And you'll see the families that are really engaged and wanting to change and the ones that are really resistant, but they're there. And sometimes that's the first step, like you're here. So is it not ideal? Sure, but at least you're here, right? And this is like several evidence-based treatments that come from strategic family therapy, multi-systemic family therapy, brief strategic family therapy, multi-dimensional family therapy, and functional family therapy. So as far as from a cultural, racial, ethnic, it's adaptable, works with many different types of people and situations. Works well with Hispanic adolescents and their families, sexual identity diversity, and transgendered youth. Okay, so that's great. There's a lot of different options, and I think structural and strategic, like I said earlier, are two very common modalities that are used often with a lot of different types of people because they are effective and can be used pretty widespread. Now, as for structural family therapy, boundaries or rules for relating, structural family therapy, again, is going to be a little different. They are obviously different from each other. We're talking about boundaries, rules for managing physical, psychological distance in family members, define regulation of closeness and distance, hierarchy. Both of them are kind of looking at that. And, it's going to be a little different. What are clear normal boundaries? A lot of times in family, as you know, probably from your own personal families, there aren't good boundaries, right? And there's a problem. We're talking about enmeshment and disengagement, close emotional contact while allowing each person a sense of identity. That's what we would consider normal. I mean, that's very broad, but like what's normal these days, right? As far as enmeshment, you want to think of like this is a good way to think of it. One of the curriculum I use for premarital counseling is Prepare and Enrich. And how they describe enmeshment, or this is one way I would gauge this with couples, is I asked them, when you were growing up, like, how did you engage, right? Like, were you a family who everyone, when it was dinner time, everyone ate in their own separate rooms? Or were you a family that gathered around the table? Were you a family that kept everybody, like, that kept all information inside the home and outsiders weren't welcome? Or were you a family that welcomed outsiders? Enmeshed families can be very confusing. Everything is like, there's this strong sense of like family is everything, no one can come in, right? So outsiders don't feel welcome. There's not a lot of individual autonomy. You can't individuate. If you leave, what's wrong with you? How can you choose them? A lot of it's unhealthy, right? And disengagement, it's like we're not connected at all. Like no one's connected. Like we're all in our separate rooms. No one's really communicating or talking. There's a lot of autonomy, maybe too much autonomy. And there's not a lot of emotional connection. So when we think of like, a straight line or a bell curve, right? We have enmeshment and disengagement on either side, right? And we have normal boundaries in the middle. Okay, so the goal would be to have some level of normal boundaries. Boundaries, if you've ever read the book, great book, should be a book you read, by Cloud and Townsend. Boundaries are, when you think about it, there's two railroad tracks that a train rides on, right? And then there's the little slats. Boundaries are the little slots in the middle. We have individual people, but we meet in the middle. Unhealthy people are like Siamese twins, right? They're connected at the hip. When one tries to individuate, the other one's freaking out, right? That's not healthy. We want to we're our own people, but we meet in the middle. And that should be the way with family. Even with children, they're allowed to have a boundary, right? That doesn't mean like they can tell you no and screw you and I'm going to do what I want. No. But they're allowed to be their own people. They're allowed to make their own decisions to some degree within reason, right? And as they grow into adults, hopefully we're teaching them how to become adults, which that's a whole other set of issues. But that's the goal, is like we want them to become independent, grown people. Okay. And so this is some of the stuff that we're working through with structural family therapy. So enactments. The therapist promotes family to reenact a conflict. This is always very interesting. So we want to map, track, and modify the family structure. Uh, uh, it's interesting watching them reenact situations. Reenactments are very interesting because it helps give them perspective. Sometimes you can have them reenact being other people in the family, which is also very interesting. Uh, Goal is to restructure the family, creating clearer boundaries, increasing engagement, and again, improving the parents being in charge. As we know, in a lot of families, maybe for some of you, you even struggle or you grew up in a family like this. It's very easy for the kids to take control. Honestly, because it's exhausting sometimes. As a parent, as I have a bunch of children and a toddler, and it's sometimes like, not that she rules our house, but I mean, sometimes you just want to wave the white flag because you just surrender, you know? So remembering that too, like when you're meeting with people, like we can say all these things, it sounds great, but it can be really hard. And I think the biggest thing in any sort of therapy or any sort of work is consistency. And that's really hard for people, is to be consistent, because it's exhausting, especially if you're breaking patterns of behavior that's been happening for a long time. Okay. So significant contributors: Mnuchin, Harry Aponte, and Marian Goldberg are big contributors. So the main phase is to build an alliance. So that's getting your clients to join with you, like you, feel like there's a rapport with you. So there's trust, right? Evaluate and assess, map family structure, boundaries, hierarchies, address problems identified in assessment, intervene to transform structure and diminish symptoms. Okay. Always preferred the whole family. Subsystems therapists could meet with individuals to achieve their structural goal. Like, so you could start off as a family, and maybe a therapist needs to get some more information. So they might say, I need to meet with the husband and wife together. I need to meet the kids together. I need to meet with this one child, or I need to meet with the wife by herself. Still the goal being the family, right? You can break up family sessions in that way. Now, you could see a family and realize, you know what? I think this minor might need their own individual therapy. That's where you're going to refer to another therapist. Or you could see them and be like, you know what? I really think mom and dad need couples counseling on top of family therapy. Great. You can do those kinds of things, but your goal is working with the whole entire family. Okay. But you can break up sessions just to get further information, because, like I said, an hour with a family is really quick, really, really quick. It goes by very quickly. There's a lot of talking, a lot going on. And so, you know, you might just need more time to better understand the dynamic. Not uncommon. So so he joined the family system as the therapist, ability to flow naturally and authentically in a variety of contexts, therapeutic spontaneity, therapist use self to relate to family, varying from highly involved to professionally detached, make it happen, do whatever it takes to make change happen. A softer style, mood from being active challenger to using humor, acceptance, support, suggestion, and seduction for same goal. So, you know, these are the types of relationships that you could have in a structural setting. I think for me, I work better in a structural setting with a family probably than strategic. I would say this is probably more of my approach with people. But that's me. Like, again, you're going to hear a lot of different types of theories. You might find one that works for you. You guys are going to be doing your genogram and looking at Bowennian and how he does things, and how he really dives into history and all that kind of stuff, which does, I mean, you'll see it like in session. Like, I go back to childhood all the time, you know, so you might find different ones that are more your style. That's okay. We just have to understand this, so you know what's going on and where things are coming from. So these are some assessments you'll do. Role of the system in the family, subsystem. So is it like mom and daughter, or dad and son, or mom and son? And you know, what's going on here? What's the hierarchy? What are their strengths? Right? Like, what's working for them? These are things that we're looking at also to encourage, like, and like, again, what's going to change the system to cause a healthier system. Clear distinction between marital and couple subsistence and parental. effective parental hierarchy, so the parents are in charge. Family structure that promotes development, growth of individuals and family. Sometimes families have, then of course, depending to culture plays into this, but they might have extended family members in there. So like grandparents may live in the home or other family members. Probably good to bring them in too, because that could be what's interrupting some of the parental hierarchy. Is there's a lot of parents in the house, right? Now, not to change, like we're not here to change culture, like especially assuming everything is like appropriate with it. It's just trying to figure out who's in charge is important, right? Like that might be why there's some undermining, trying to have a healthy dynamic with all the dynamics, right? The generational stuff. And that's not uncommon to have generational situations, especially today's day and age, economy, all the things. People are living together, but that can be very confusing for kids, especially too if parents are working, grandparents are helping. There's a lot of confusion, right? And like, no one's listening to mom, but maybe they listen to grandma, or no one's, whatever, and that can cause issues, right? And there might be some unhealthiness there that needs to be addressed. Okay, so enactments are used for spontaneous enactments of problem or to target a reported problem in interactions. And it's used to restructure the family so that we can get an outcome we want for change. So listen for rules and assumptions that display the family structures or boundaries. Can you reenact what happened last night? Please show me what happens at home when he is defiant. Stop a family member from interrupting, speaking for one another. Rearranging chairs physically to increase or decrease emotional closeness. Especially this is something you can observe, like I mentioned, with how they all sit in the room. We could do things like that, right? Which is always like, how people are, like if you attend church, like people are all particular about where they sit. That's their seat, they like claim their spot. It's just so interesting. And so people will do that in therapy, like that's my chair. That's where I sit, so you can kind of disrupt that, which is always so interesting. Systemic reframing highlights complementary relationships in the family. Piece together members' description of problem and reframing to reveal broader systemic dynamic. Again, trying to figure out complementary relationships, hierarchies, and boundaries, and use interactual patterns to describe the problem in a larger context. Okay. So how do we make a boundary? We're going to utilize over and under involvement to help families soften rigid boundaries or strengthen or diffuse boundaries. So, again, like boundaries can be, who knows why they have whatever boundary they have. It could go back to past things. It could be like it just evolved into this. Maybe there's a dynamic of another family member. And so we're going to have to kind of dive into that, but kind of disrupt it, right? So we want to challenge unproductive assumptions by questioning operational assumptions in families. So a common like assumption, right? Kids come first, right? That's something to be challenged. I think oftentimes in our culture, like we have this like feeling like the kids come first, but like what happens in that is the marriage doesn't. And then we have a high divorce rate, all these kinds of things. Now you may disagree with me, that's okay. You're allowed to. But if the parents aren't focused on themselves as a couple, then what's going to be left once the kids are out of the house? And so that's where a lot of couples lose sight of each other. And with the kids come first mentality, this is where we see the hierarchy things get all out of whack, like who's in charge, all those kinds of things. Now, this can feel very tricky in a blended family, right? Especially if both couples or both parts of the couple are bringing in children. It's like, well, it's my kids. I need it, But at the end of the day, if you want to stay married, we have to evaluate some of those things and look at some of those things, because again, kids very much not in their intention, but like can suck the life out of you and cause you to be really distracted from your partner and lose sight of your partner, right? Because of the busyness of life, how we can get caught up in all the activities and all the things. And so That's like a very much an American concept, like kids come first, kids come first. And I would think that way too prior to getting into this field and we're really working with people. But again, if people want to stay married at the end of the day, we have to keep everybody in their proper place. Not to say your kids aren't important, and not to say that at times there can be needs that's like, I have to drop everything to attune to this. But like, so much of what sucks up our time with our kids is oftentimes their extracurriculars. And so we will, do anything we can for a lot of these extracurricular things, but at what cost? And it keeps us not with the family. Okay. So just something to think about. Again, everyone's entitled to opinions. I'm not telling you you're a bad person if that's what you think or feel, but just some thoughts. If I give here, you should give there. It's better for the kid. It's better for the kids for us to stay in this unhappy marriage. A lot of people think that way, right? Like it's better for the kids. Well, if we can change it and not make it unhappy and make it happy, I mean, granted, happiness is fleeting, but like, how do we make it consistent? How do we make it where I'm content in my marriage? Like it's not, it can be happy. It can be frustrating, but I'm content. I think we should look for contentment in a lot of things in life and not these over the top feelings, because we can't keep the over the top feelings all the time, right? It's nearly impossible. So these are the things that we're looking at. We're wanting to disrupt, we're wanting to change. And again, wanting to provoke change sometimes is going to cause feelings to come out and frustration. And I think the therapist is going to set the tone for that and how they handle that and how they work through it. It's not personal. It's their situations that are personal to them. And so trying to work through that and not be intimidated by it either. It's very easy to be intimidated by a group of people in a room, but that's not beneficial to us either. Like we have to be able to hold our ground, know our role, and work through whatever challenges that come up with the family, especially if there's intense situations or crises that happen. We need to be able to work through that together with the family. Unbalancing, used for extreme difficulties in hierarchy, right? So if there's like some people that are really like enmeshed or really like triangulated or something, we're wanting to unbalance that to try to affect change, because if we can't do that, it's gonna be really hard to get change and change that stays, right? And so that might mean us joining with somebody and potentially like disrupting a subsystem, which again could be really challenging, but could be really helpful because it will allow people to maybe see what they're doing and or maybe figure out how we can shift to have the proper hierarchies be where they should be. Okay. So the therapist, when possible, works with the family to expand, their core beliefs, maybe in new ways. And again, we're not trying to maybe change their vision necessarily, or change that they love each other or anything of that nature, get rid of anybody, but like, let's shift things so it's healthier. And that's going to look different for every family, obviously within legal and ethical realms, but let's make a shift so that we have outcomes that we want, and we can have relationships that are lasting and a desired way of living, so that we function better, right? What family doesn't want to function better? And so anyways, I hope this information was helpful. Gives you a little like highlighted look at these two therapies, or I'm sorry, these two modalities, these theories, ways of approaching family therapy. They're great, very commonly used. So anyways, have a great week. Take care.